Hi, this is Dr. Peter Kahn. I practice functional medicine and functional neurology in our practice in Gilbert. We help patients with chronic health conditions such as autoimmune disease, chronic pain, and thyroid issues. Now today I want to share with you a very interesting case of a lady who came to us with chronic pain that she has since 1981. Think about it, folks. That's 30 plus years of pain. I mean, she's been to every doctor that you can think of. She's been, have all type of different tests, x-rays, MRIs. She had this chronic pain, mostly all on the right side of her body, right hip in particular, but also just the right side of the body and overall. She had trouble walking. She couldn't walk very long distances without the pain just stopping her. She couldn't even climb upstairs. She kind of had to go upstairs like one step at a time like this instead of walking, both feet. She also had a lot of digestion problems, actually. She had constipation, gas, bloating. She always would see mucus in her stool, have heartburn. She also had severe fatigue, brain fog, ward loss, and mood issues. So you see, it wasn't just a pain problem. She had really symptoms in multiple areas, and her doctor was just treating her symptoms as pieces, right? Treating the pain as a separate problem from the gut problem, separate problem from the brain problem. And guess what? It was all the same problem. I'll let her tell the story.
Yes.
Well, my right hip and back area, actually the whole right side of my body, has been in pain for over 2.5 years. Actually, the top part of my body was in pain since the 80s.
Right.
And since coming here...
Now, hold on. So you had it for 2.5 years.
2.5 years.
How severe was the pain? 0 out of 10, 10 being the worst pain.
10.
10. Wow. So, you had 10 out of 10 pain. You've been to doctors for this, right?
I've been to every kind of doctor you can imagine. A family physician, a chiropractor, pain management, physical therapy, orthopedic, acupressure, acupuncture. I've had everything possible. Medications that made me all drugged and
what was the response to all these treatments? Like, did you feel any better at all with any of them, or did it last?
Oh, temporary for a week. And if I didn't, keep up the exercises and I was still in pain. I'd get up in the morning. I didn't know when I was going to be in pain. I'd get up in the morning and I couldn't walk. And then...
So it was so severe you couldn't even walk?
Right. I couldn't go up steps. Except, left foot first and drag my right foot, left foot, drag my right foot. Couldn't walk anymore, couldn't go on hikes, couldn't ride my bike. I can't even express my gratitude for how I feel. I'm probably down to a 2 to a 0. Today, right now, I'm at 0 pain.
And this is the first time in 2.5 years
That's correct.
that you have relief. And this is like pretty consistently low-level pain, right?
That's
correct.
correct.
The treatment has been, the results has been consistent.
It's been wonderful.
It's
yes.
staying with you.
Yes, it is.
And so what are the things that you can do now that you weren't doing before?
I can go up steps. I can go up steps like a normal person. I can hike. I can bike.
You're hiking now.
I'm walking about 3 miles a day now.
Oh, wow. And you weren't able to do that?
No, I wasn't. And I'm able to ride the bike about 3 to 4 miles a day, too. All you guys have done here to help me, I'd probably be in a wheelchair in a matter of months.
Wow. So this has improved not just the pain, but also overall health.
Quality of life is just phenomenal, yeah.
Now, what do you feel like is the biggest difference between what we do versus what you have tried in the past? Because you tried everything, natural and conventional.
You're a family here. You care. You truly care. And
So what did we actually do for her? What did we find on her to help her turn her health around and actually get her life back? Well, on her exam, on her blood test, we found symptoms relating to inflammation markers. But again, inflammation marker on blood test just tells you there's inflammation. It doesn't tell you what's causing the inflammation. So when we did a specific test that we do in the office called bioresonance testing, we found that she actually has stress to the bone marrow. And the bone marrow, as you know, is found in the bones. And this means that this toxin was found pretty much everywhere. That she had cadmium and thallium. These are 2 heavy metals that we found in her bone marrow that was creating problem. We also found stress in the frontal lobe. We found silver amalgam, which is mercury in the dental fillings. And that's a really common finding. We also found lead as well in the frontal lobe. That was causing her to have slowed cognition and slow speech. We also found stuff in her stomach, in her GI system. So in the stomach particularly, we found pesticide residues, found herbicides. We also found antibiotic residue. So these are things that chronic accumulation of these toxins was shutting down her GI function. We also found in her large intestine, we found enterococcus, which is a type of bacteria that was causing problems. She had a gut infection that was causing mucus in the stool. So once we were able to detox them and address these issues, oh, by the way, she also had a left frontal lobe weakness. So because she had right-sided pain problems, what she actually had was a left-sided brain problem causing right-side control. So she had a lot of problem with the right side. So we actually did brain-based therapy to balance her left and the right brain out. We do specific therapy called pulse electromagnetic frequency therapy to help increase cellular energy. And guess what? In about 6 weeks, that's what you got. We got a new person. She's able to walk. She's able to climb stairs normally. She's able to now bike and walk 1 to 3 miles every day with very minimal pain or no pain. Her digestion symptoms completely resolved. I mean, we got her life back, and she's one grateful lady. And we're grateful for her to actually come in and to let us help her. So if you'd like to learn more about what we do, you can attend the next Chronic Pain Fibromyalgia Solution Workshop. This is on Wednesday at 5 o'clock. You can register by clicking on the link on this post, or call 480-988-6269. We'll get you registered. I look forward to seeing you there. On our website, we also have over 80 video testimonials of people who's been everywhere, done everything, tried everything else, and they didn't get better until they found us. So I look forward to seeing you at the workshop to learn how you can get your health back and finally get relief. Thank you.